Welcome everyone, and thank you for attending today's webinar with Fullscript and Oova. My name is Sarah. I am part of the marketing team at Fullscript, and we are very excited to have Dr. Beck Hoen and Dr. Natasha Montpellier with us today to discuss how to streamline provider-patient care with Fullscript and Oova. Before we jump into the presentation, I wanted to go through a little bit of housekeeping first. So just a reminder that this recording will be sent to everyone who registered. So if you have to leave early or would just like to watch it again, you will have access directly from your inbox. The recording will also live on Fullscript's webinars page, where you can access all of our past and upcoming webinars as well. And throughout the webinar, if you have any questions, please add them to the chat section, but get to them during the Q&A portion at the end. With that being said, I'm going to pass it over to Dr. Hoen to take it away, and I will rejoin you closer to the end of the presentation for our Q&A.
Thank you, Sarah, for that lovely introduction. We were just talking before we got going here that Sarah and Artie have been really lovely, and this has been a great experience for me so far, getting to meet Dr. Natasha on the other side of the country.
Likewise.
In another country.
Yeah.
So I'll just start with introducing myself here on this slide. And my name is Dr. Hoen, and I'm a board-certified fertility acupuncturist and herbalist with over 10 years of clinical experience and additional training in functional medicine. Mighty River Wellness serves as my LA-based clinical practice, and I focus on clinician training on the college level. And I'm really proud to say that I get to be a medical advisor at Oova. It's a really nice passion project to be involved with for me. And in my spare time, we've been talking about this quite a bit too, is that I enjoy trail running with my enormous horse-sized dog.
And hi, everyone. I'm Dr. Natasha Montpellier. So I'm a naturopathic doctor in Ontario, Canada, which is why we're at opposites in different countries. So I've been practicing for close to 10 years. And for most of that time, I've been focusing on women's health and a little bit more precise in fertility. So it's really great that we get to talk, both Dr. Hoen and I, about this topic today. For the past 3 years, I've been working with Fullscript, and my role at Fullscript is essentially to provide providers or practitioners like yourself evidence-based education. So that's my role here. And just a little bit about me. So when I'm not seeing patients or educating practitioners, I am working on my goal of creating my little homestead at my place. So I'll pass it back to you, Dr. Hoen, and we'll get this presentation started.
All right. Thank you so much. So I wanted to just give a little bit of background and context about what Oova is. So Oova is the first hormone measurement tool, and it captures quantitative hormone readings in real time, and it uses an at-home urine test. So users pee on cartridges that measure 3 hormones in urine: luteinizing hormone, an estrogen metabolite, and a progesterone metabolite. So 10 minutes after peeing on that cartridge, the user can scan the test to the Oova app on their smartphone, and then Oova translates those results into real time, providing accurate, quantified hormone data. So it really has a lot of benefits for both the clinician side and the patient side. So the first piece is really monitoring that estrogen metabolite. And estrogen really provides crucial information about the estrogen level in a patient's cycle. Monitoring that E3 can help us understand the follicular phase, ovulation, and overall estrogen balance. And then that luteinizing hormone piece is really critical for pinpointing ovulation. Its surge indicates the most fertile period of a woman's cycle, and it aids in precise timing for conception efforts. And finally, when we refer to progesterone, progesterone reflects that confirmation of ovulation that we need and assessing luteal phase health. So it ensures that that second half of the cycle can support a potential pregnancy. I love Oova so much because it allows the patient to have agency over their own health data, and they can collect in the privacy of their own home. So the scans really allow both parties to see those results immediately. And this immediate feedback in the form of a smartphone app can provide those instant results to their and really see their hormone levels. So this quick turnaround helps the clinician in terms of timely decision making and interventions. So Oova is a really convenient tool, right? Because all you need is a smartphone, but as always, a bathroom would be nice too. And the HIPAA compliancy on the Oova dashboard gives clinicians and patients alike a really nice peace of mind. And we're also going to talk about that Oova Fullscript integration, which creates a powerful clinician management system. So how do you use Oova? So I particularly am really focused on the trying to conceive space because I think it establishes personal hormone baselines. It can identify that precise fertile window and those ovulation dates and ensures that users really know the best time for them to conceive. It can also optimize fertility because it can capture unique hormone levels, cycle lengths, and egg release patterns overall. And it provides really specific and actionable fertility insights. It can uncover the exact cycle length and hormone baseline and analyze those cycle trends. In terms of treating hormone imbalance, it can measure unique hormone levels with lab quality accuracy and enables in diagnosis and treatments of hormone imbalances based on those personal norms. And it can really track the patient response to those treatments. In terms of supporting proper diagnosis, it can identify those irregular cycles that you might have or hormone imbalances and provide accurate understanding of cycle trends and those hormone levels. We also use it for symptom management and cycle syncing because it can unlock hormone health insights linked to cycle-related symptoms and map hormonal changes to symptoms like stress and weight management. And it also monitors symptoms during the luteal phase for clear understanding. And I love it, actually. We were talking about this as well for tracking and managing perimenopause. This is huge. I don't know if any of you clinicians out there have dealt with perimenopause, but it really is a challenge in the terms of trying to get that turn on a dime intervention for those patients and really serving them so that they're not clawing your eyes out because you're playing whack-a-mole with their symptoms. Because Oova really identifies day-to-day trends and month-to-month progress, and it can track that ovulation and progression through perimenopause. And it also can monitor symptoms for comprehensive views of those changes. In terms of PCOS, it can provide accurate insights on irregular cycles and hormone imbalances, and it can support management of the menstrual cycle, fertility, and symptoms, and fertility for PCOS. And finally, wrapping it up with our athletes in the group, it can really personalize training regimens and it offers personalized hormone tracking insights, tailors training regimens to fit a really unique cycle and those hormone levels throughout the month. And it moves beyond standard regimens to really personalize plans to create success. So Oova is also really on the clinician side results oriented because it really gives the clinician quantitative results to the patient data, allowing you to see exactly what your patients are responding to and any lifestyle adjustments that you've recommended. With detailed lab quality analysis at your fingertips, you can easily target and track specific areas, then make subsequent recommendations based on what your patient's Oova's results are showing. In summary, on this slide, I really feel like it allows practitioners to do what they do best, which the patient data and the treatment recommendations are all conveniently in one place. And this makes the ease of operations really easier. So I learned about Oova years ago listening to a webinar, and I found the founder so engaging and amazing that I was instantly implemented using the kits in my clinic. And as a result, that particular year, my live birth rates went through the roof. But what I really noticed is that although Oova made it really easy for real-time patient data, there wasn't a really simple way to make those real-time recommendations easily. And that's where Fullscript comes in. I started connecting the Oova developers with Fullscript with the idea to make this part of the patient process easier for clinicians. And this integration really shines for clinicians that may not have a Fullscript integration with their current EHR, but they really rely heavily on real-time hormone testing. So the results of these two tools working together is shown on this slide here. And this is really the crux of what Dr. Natasha and I are going to be talking about today, and how these two tools really work seamlessly together to support both the clinician and the patient full circle in the treatment cycle. So in the first piece here at the top of the circle, we see the information collection phase. And the Oova Clinician Dashboard is the method by which the provider can monitor the patient's data and really see a baseline so that they can make an assessment. And during the treatment planning phase, a provider has access to both the Oova data and the provider tools within Fullscript. Treatment delivery is handled directly through email communication with the patient. And at the top, closing the circle, again, at the bottom rather, this is the treatment maintenance piece. And using the Oova platform, if a provider needs to make adjustments in real time, they can do so right then and there. It's pretty cool. So now we're going to talk a little bit about this case. And this case really was really interesting because I had this patient in my life cycle for a very, very long time, which was great. So this is Amy, and she identifies as female. She's married. She has a really stressful job in upper management at a major tech company. She'd been trying to conceive before she came to Mighty River Wellness for 2 years, and she had one failed IUI and one failed transfer. She had a history of fibroids, and the reproductive endocrinologist at the time suspected endo. She also had psoriasis that flared intermittently on her lower limbs, and we later correlated that to food sensitivities. She conceived naturally with Mighty River Wellness in December of 2023, but sadly miscarried at week 6. I mentioned that she has a really stressful job, but I really wanted to hit that point home. And the commute was very, very long. So it was just this compounding didn't give a lot of time for health management. At the end of the day, she really didn't have enough starch or wherewithal to kind of manage her health at the time. She really has low energy overall, and that's one of the main chief complaints. She craves sweets, and particularly she has that really interesting slump at 2 or 3 o'clock in the afternoon after lunch. She has really poor digestive health on both the TCM side and the functional medicine side because she has one bowel movement a day, and they're small, pebble-like, and incomplete. Cycle length is 28 to 32 days, and it's around a 3-day flow. She has cramps and mild breast tenderness before her period. And now after this case this was the TCM assessment plan that we kind of talked about when we started establishing a baseline with her. So she was diagnosed with spleen Qi deficiency and yang deficiency. And our goals were really simple to start. So support pituitary function, work on some nutritional counseling and talking about the importance of blood sugar regulation, incorporate regular physical activity and use some more stress management techniques, and generally just recover from IVF, right? It was, as you all know, probably that the IVF process can be emotionally really taxing as well. So this is what we were looking at in terms of, this is where Oova really gets me excited, because we can see that as fertility acupuncturists, we really love to look at the graphic representation of somebody's hormone health. And generally speaking, before we did it with, we implemented body basal temperature charting, which as some of you know, is a little bit antiquated now that this tool is out there, because now we can actually see more accurate representation of what those metabolites are doing, right? So we have a pretty exciting, we still have a luteinizing hormone rise. It's not super exciting, but it's still there. And we confirm that the luteinizing hormone, that the ovulation happened because of the presence of progesterone. But if you look at the progesterone level overall, this is where it gets really cool, is that you see this kind of sawtooth profile. It's very erratic up and down. And this is really showing us the second half of the cycle and the luteal phase. And this is Oova really coming into gear here, because this is one of the first pieces of at-home urine testing that actually showed this. This was a couple of years ago. And it was like nobody in women's health was really at the time looking at what the luteal phase looked like. And this was the Oova was like, no, we should totally show that. I'm going to stop share here and move to my other screen so that you can see really quickly what the Oova dashboard looks like and how to make that recommendation. So here's what the Oova, the clinician dashboard, looks like on that end. And so we can see that we have the hormone charts. We can check to see a specific interval if we want to. And then we can create a PDF report after the cycle is over and give that to the patient. But the real kicker here is the Fullscript recommendations, right? So right there, I see the hormone chart, and then boom, I can go to the recommendations, and I put some recommendations in so that you could kind of see what we were doing. And then this just gets sent directly to the patient. So just not to get too granular here, but I phased some traditional Chinese medicine patent formulas that are also amazingly available in Fullscript. So I used a follicular phase formula and then complemented that with a second half of the cycle luteal phase formula, and used a little bit of Vitex here just to help regulate the follicular phase a little bit more. And then for the poor digestion, I just started with something super simple, like a digestive enzyme. And I'm going to stop sharing. And, oh, I can switch screens right there. That's cool. And I'm going to go back to my slides here. So just to show you guys, so this was the before, right? And just driving that point home to see that, okay, that progesterone level needs some work for sure. And then moving forward, and this was Amy's results after being on that Fullscript recommendation for a couple of months. So as you can see, she knocked the luteinizing hormone out of the park. It's really, the concentration is a lot, that signaling is a lot stronger. She's got a really nice, healthier ovulation response. And then our progesterone is textbook here, right? So for a fertility acupuncturist, we want to see this really pretty, consistent progesterone output overall. And so if we had to make an intervention here, cycle by cycle, we could do that from this dashboard, which is really great. And so the person's not infertility acupuncture, it's time is always of the essence. It's just like making those improvements to a person's cycle. They don't want to wait around for you to get results about their urine metabolites and then make an intervention. They want you to be able to do that at a moment's notice. And this is where Oova and Fullscript really shine. And that being said, I'm going to stop share and send over screens to my lovely friend, Dr. Natasha.
Thank you very much, Dr. Hoen. I'm just going to share my screen. Awesome. All right. So thank you so much. And that was like a really great case to demonstrate really, and I really want to drive this point home. You mentioned it, but I want to say it again, like Oova really empowers us practitioners, right? With real-time data to make that diagnosis and then to really create a customized or individualized treatment plan. And also, just as important, it empowers our patients, because the fertility journey can really take away a lot of our empowerment, and it's a very challenging process. So it's a really great tool for that. So what I'm going to be talking a little bit more about is some of the features in Fullscript that can help streamline some data collection along with Oova, and some of the treatment planning, delivery, and maintenance. So we're going to start, these are all the features we're going to go over, and we're going to hop from screen to screen a little bit. We're going to start on the slide deck, and then I do want to bring you in the application, just like Dr. Hoen did with Oova. But we're going to start with current supplements, and then most of them will go into the application. So I'm just going to move that forward. Okay, so here it's current supplements. So this is part of your data collection process. So I'm sure I'm not the only one whose patients will often bring a bag full of supplements, or perhaps a very long list. And you have to then put that into your EHR, or if you're doing paper, you have to put that in. And that's a very long process. It takes away time, valuable time from your appointment, to actually, do your intake. So putting all that accurately into your EHR. And on top of that, the only way to make sure that list is up to date is to, again, take time from your appointment to go through that list with your patient. So this is where my current supplements rather, comes in. And I know the video is going a little bit quick. When we go into the app, I will show you again how you can access it. And I think maybe I can have it play again. Perfect. So here on this dashboard, you can actually, where we see like copy link, you can embed that link into your intake forms. And so it becomes part of your workflow that your patients will receive their intake form and then be prompted to go into Fullscript, create their account, and then put in their supplements. Here, you can also directly send a specific patient an update or a prompt to fill out their current supplements. So if you're having a follow-up appointment and you want to make sure that their supplements are up to date ahead of the appointment, you can send this prompt, and then you'll be able to see what they're currently taking. And here on the screen, you can see that not only do you get a list, up-to-date list of their supplements, but you get an ingredient breakdown. So you're able to see if your patient is taking too much or too little of a specific ingredient. Now, 2 ingredients that come to mind that can be problematic are vitamin D, right? That you can find people can take solo vitamin D. They might be taking something for their bones that has vitamin D. They might be taking their prenatal. They might be taking a DHA with vitamin D and end up taking way too much vitamin D, which is problematic. And another one I found is folic acid, right? That's another one that could be in a prenatal. That could be maybe they're taking solo folic acid, maybe they're taking a B complex, and they end up maybe taking too much. But of course, there's also the reverse, where maybe somebody is not taking enough of a particular ingredient to have a therapeutic effect. So that's where the ingredient breakdown really is handy. So that is the current supplements, and this is the practitioner view. And I do want to show you the patient view, because that's not something us as practitioners, we don't always get to sneak peek at the patient experience. So I'm just going to show you what that looks like. I'm hoping that, yes. Okay, perfect. So here it's a very straightforward. They go onto their dashboard. They have plans, current supplements. And in the current supplement section, they can just add supplements. And so this takes into account supplements that are available on Fullscript, but also not available. So here we have, I think I took an example of one product that is available on Fullscript, which is indicated by a little Fullscript logo. And the other one that is not available, which I think is the DHA Nordic Naturals, will not have anything. So you'll know as a practitioner which ones are available and which ones are not available on Fullscript. And so we have the basic prenatal by Thorne, so that's available. The patient puts that all in, and then that's going to be updated on your end, and you'll be able to see that. So it's a really quick way to make sure that you know what your patient's taking, and also just from a point of view of interactions, right? You want to make sure that you're not recommending something that might negatively interact with another supplement that they're taking. So now we're going to do a little bit of hopping around. We're going to go into the application. Stop. By that, I mean into the Fullscript account. And I'm just going to share that again. Okay. All right, I'm just going going to give our little tab here. Okay, so I am kind of just, there you go, perfect. Okay, so now you see the entire home screen. So I've already mentioned where you can access your current supplements or the tab. So it's right here. And then you have going to your specific patients. You can then find your specific patient to send that recommendation for the current supplements. So current supplements, you get to see that breakdown right here. So that's what that video is showing. But what I'd like to talk a little bit more now that we're in the application is some of the treatment planning tools, specifically templates. So templates used to be called protocols. So if you are, OG Fullscripter, you probably are aware of protocols. We've changed that to templates. And that's really more of an accurate term because they're a starting point for your treatment plans and not a prescriptive protocol. So you can use that and modify it to customize it to your patient's needs. But let me show you where you find the templates, how you apply them, and how that all works. So you can go into plans, and then you go to templates right here. And I want to call out that you can create your own templates just by clicking the build template, but you can also use Fullscript's evidence-based templates that our integrative medical advisory team has put together. And essentially these templates have 3 to 5 evidence-based ingredients that you can apply to your treatment plan. Now, I would recommend everyone to take maybe 5 minutes and just kind of look through some of our protocols or templates. We have, I think, now closer to 50 templates in the dashboard in the application that you can have a look at. But I'm going to just pull one specifically. So we are working with fertility, and I know that we have a fertility protocol. So we're just going to use this search bar, which I think it's probably the best way to find protocols or templates. I'm going to be just saying protocols now. Templates. Right here, you can filter by all the templates, just the templates you've created, or made by Fullscript. And that's what we're going to focus on today, just the ones made by Fullscript. So we have a Fullscript fertility protocol. We're going to click on that. And I'm just going to go on to this evidence tab. And this is where you see all of the evidence for the ingredients suggested for this particular condition. So you have, for example, myo-inositol. You have these are all linked. So you can look at the original research. This is for the suggested dosing. And then also just all of the research that is of higher, grade, I guess you'd say. So we're looking at systematic reviews, meta-analysis, randomized, double-blind, placebo-controlled trials, all those. We try to prioritize those studies just because they have a little bit more higher quality for the evidence. So you can see through all of this, the evidence for each of these ingredients. And for each of the ingredients, we pair with a product. So if you go into preview, you'll see that you have a product list. And now these will all match the ingredients for each template. These products will match the ingredients for that particular template. Now, the reason we do this is to really help you streamline your workflow so that you're not reading the template and being, okay, now I have to go in the catalog and look for that particular product that fits not only the form of the ingredient, right? Because there can be different forms. If we just take in consideration inositol, there's myo-inositol, there's decaro-inositol, you can do both together. So you could just be sure that, okay, this is the right form of the ingredient and also has the right amount. So the dose is where it needs to be. It's not just like a fraction or just a part of a larger formula. So you can easily apply this to your treatment plan and then also then modify it at will. The other thing I want to call out is that most of our templates also have these handouts attached to it. So different handouts that are relevant to that particular condition. So here we have a basal body temperature tracker that you can include. But we have other assets, and I will show you how you can add additional assets. So from here, we're just going to use the example of this particular template, and we're going to add it to our treatment plan. So if we look right here, this is our treatment plan. So we're just going to click on that. It's going to bring us to the treatment plan tool. And we haven't assigned us a patient or a client, but you can do that at any point before sending the treatment plan. And so we can see that we have all the products with the dosages. Now we can, like I said, customize this. Now what I'm going to do to customize it is that I'm going to change this inositol capsule to powder, because I find that to get the therapeutic dose, you end up having to take multiple capsules. So it's easier to take a powder. It doesn't really taste like anything. And I find that most of my patients find it easier that way. So I'm just going to remove the sensitol. And then I'm going to go all the way to the bottom, and I'm going to go add item. So here is our catalog search. So I'm just going to put in inositol, and we're going to click on the ingredient. And here on the left-hand side, we have our filters, which you can, toggle on or off. Same thing with this. You can toggle on or off if you want greater screen space. And specifically for these filters, Now, I just want to call out, you can search by brand. These are probably some of the filters I use most. Brand, form. We want to use form because I want a powder specifically. So I'm going to go into powder. I'm just going to minimize this so I can show you the other filters that I find that are worthy of calling out. So allergens. So if you have any patients with allergies, you want to make sure that maybe it's nut-free, gluten-free, fish-free, egg-free. You can make those selections as well. And then the other one is certifications. This has to do more with quality. If you're looking for something that's non-GMO or NSF certified or CGMP, vegetarian, all of these different certifications so that you can really find the perfect product for your patients, with taking in consideration what they value. So all that said, for us, we're just going to keep it pretty simple. We're just going to look for a powder and inositol version. So we're going to go with pure encapsulation. So I'm going to add this to my plan. And it should pop up right here. So I'm going to go back, and at the bottom, we should see our inositol powder. Perfect, it's right there. Now, I also want to maybe add a handout. So we already have one here, but I'm going to add a different handout to this treatment plan. So I'm going to remove this one because we're already doing Oova, so we don't need to track our basal body temperature. And we're going to go to resources. So it's under catalog, resources. Now, similar to the templates, you can upload your own resources. So this becomes your own big library of all your patient resources. So you can search by your own resources, or you can look also at the library that Fullscript has created. Now, again, there are many, many resources. So I do recommend kind of taking a few moments and just putting some keywords and see what pops up. I know that we have a pregnancy handout that's on nutrition, so I'm going to try to find that one. And I'm going to do Fullscript created only. And this is the guide that I want. So your guide to a healthy pregnancy. So you can have a look, you can view the resource, you could download it if you want to prefer, have it like email it to your patient, or if you're providing a hard copy, you can print it out. But I'm just going to add it to my plan so that my patient can refer to this as she's doing her research to become pregnant. So I'm going to add that to the plan. And so we should have her resource all the way at the bottom. Now I want to call out again this ingredient intake. Just like in current supplements, you have the breakdown of all your ingredients for your treatment plan. So again, if you are potentially accidentally overprescribing a specific ingredient, you can see that within this screenshot. So very, very useful. All right, I'm just going to quickly glance at my notes to make sure I haven't missed anything. Okay, so we have two last features I want to talk about. So we're going to just get out of our treatment plan. We're not going to actually send this to anyone, but I want to call out our favorites category. And I'm actually going to stay in here for just one more second. So favorites are an excellent way to really cut down on the amount of time you are researching the same products. So I have go-to products. I'm sure all practitioners have go-to products. And sometimes, if you haven't used it for a while, you have to remind yourself, what was that specific inositol that I recommended to that patient? So categories is a really great way to basically label your favorite or categorize your favorite products. You can do this being very broad. You can have a category pregnancy support, and in there you have your prenatals, your folic acids, your favorite iron supplements, your DHAs. It's all in your pregnancy support. Or you can be very specific and say, I want all of my prenatal supplements category. So I know all of my favorite prenatals. So if I need a prenatal without iron, I could just go to that category. Maybe I need a prenatal without copper or something. You can have all of them in that particular folder. So you can add to your favorites category directly from your treatment plan. So if you're like, oh, I just discovered this product, I really love it, I want to add it to my categories, you just go right here and you add it to favorites. And this is obviously a demo account, so there's a whole bunch of different categories. These do not come pre-populated, so you would just create your category ahead of time, which I will show you how to do in just a moment. But just to show you that you can do this from your treatment plan, and you can also do this from your catalog. So I'm just going to do inositol again. And I'm just going to remove this so that we see a little bit more. So if you see a star next to a product, it means it's already part of your favorites, but you can go to add to favorites. And again, like if we're looking for fertility right here, it's now part of our fertility category. And to manage your entire favorites categorizations and which products are featured in there, you can go to your favorites tab right here on the left. And then you'll see all of your favorites. But if you want to see specifically your favorites for a specific category, we'll just go to fertility. And then from here, you can rename, you can completely delete it if you want to start from scratch, and then you can remove or add any products to this particular category. So again, it's all about saving time and just having like your lists together. And this, of course, you can change at any point in time, right? It's not static. It's just a tool that can be very helpful. All right, so this is the app or the platform. I'm going to switch back to my slides just to finish off with a treatment maintenance. So just give me one moment to switch screens. Okay, so we're back here and we're just going to go to AutoShip. So treatment adherence is probably one of the biggest barriers to overcome with our patients. We can craft the best treatment plan, and sometimes, unfortunately, patients don't stick with it. And AutoShip is one of those tools that we're trying to use to help reduce that drop off in treatment adherence. And so essentially what AutoShip does is that it takes away some of it accommodates for the forgetfulness, I guess you could say. So if we run out of a product, sometimes we don't necessarily have time to go back into the application, make that order. AutoShip essentially just sends it right directly to your patient. So patients, I want to direct everyone to the slide. So here, let's go to the cart. I'm just waiting for the cart to pop up. So here you can see that there's 2 products, and the patient can determine the frequency for each product. So it doesn't mean that because they're in the same treatment plan that they are going to be shipped at the same rate, because the prenatal has 90 capsules. It only needs to be shipped once, like every month, whereas the DHA, it's every 2 months. So you can really customize that. And when you go into, or your patient goes into their AutoShip folder, they can therefore cancel it very easily or even change the frequency. So it's really, I know that sometimes people are afraid of these subscription models, but this is really something a patient can easily start or stop and modify, just so that it's less work to remember to order their next supplement, right? So a lot of patients I find will be like, oh, I ran out of it and I forgot to order it, and it's been two months, right? So just to help with getting them closer to their goals. So that's AutoShip. I have one more slide, and then I think we'll be ready for some Q&A. I just wanted to call out, because as I mentioned when I was talking about templates, we have close to 50 and potentially more than 50 templates available in app. And if you don't have the time, I just wanted to call out some specific templates that are around women's health. So we already went and discussed the fertility support. That was kind of the example that I used. But we also have a oral contraception support. So that's essentially a protocol aimed at preventing nutrient deficiencies that may be associated with oral contraception use. So again, all evidence-based, you can see the research that's there. The ovarian health is more around PCOS, so helping with ovulation and things of that nature. And then menopause support is a little bit more around that hot flash support. But there are additional protocols for women's health, and then there's a whole bunch of protocols for cardiometabolic health, neurological, mood, digestion. All those protocols are available in the app. You just need to search for some keywords and then they'll come up for you. And this is just, I want to kind of finish on this slide. So if you are new to Fullscript, we have a sign up QR code for you on the left. And if you are new to Oova, we have a sign up QR code for you to check it out and register and see how this can really empower your patients. And I think I'll stop sharing, and Sarah, I think you'll hop on for some questions.
Perfect. Thank you both so much for the wonderful presentation. If anybody has any questions, please feel free to drop them in the chat now. We had a few come through during the presentation though, so we'll start there. The first question is, what is the process for updating treatment plans within Fullscript based on ongoing hormonal changes tracked by Oova?
Do you want to take this one, Dr. Natasha, or you want me to?
I think you can start and then I can add anything in addition to that.
Yeah. So I guess what you would do is you would go to the Oova. The Oova Clinician Dashboard is really unique in the sense that once the patient links up their account with the Oova app and then the clinician portal, you can really use that as a cornerstone for communicating with your patient. And if there is an intervention that needs to happen or to be discussed, the two of you guys can go over it in office, which is generally how I handle it. And then right from there, you can just start a new recommendation and then just send that directly to the patient. Does that, and then the fulfillment would be on the Fullscript side.
Yeah, exactly. Yeah, you're creating a new treatment plan for your patients. You're not necessarily erasing a past treatment plan, so you're just creating a new with the real-time data you're getting from Oova. Yeah.
And it really shifts around too, right? I mean, not to get down the rabbit hole here, but there might be other testing that you do, or obviously I mentioned digestive health. You might want to support that differently based on how the person's gut starts healing. And then obviously the TCM progression of formulas really evolves as the patient evolves. And that's really the power, is to be able to really update those recommendations.
Mm-hmm.
Perfect. Thank you both. The next question is, how does Fullscript decide on which brands go into their templates?
So it's based more on which products are most aligned with the research. So like I mentioned in the presentation, we're looking at which products have the correct form, right? Just for example, there's a lot of different types of magnesium, right? There's magnesium glycinate, citrate, malate. But if the research for example, for high blood pressure, and the research is saying magnesium citrate is the formula, then we're going to prioritize the products that have that particular form of magnesium. And secondly is if the research is saying 600 milligrams of magnesium citrate is what's required to reduce your blood pressure by a certain amount of points, then we're not going to recommend a product that has 100 or 50 milligrams of magnesium per capsule. Your patient is ending up taking, how many capsules per day. So we're going to prioritize the one that has the closest to that therapeutic dose. So those are the two big criteria when it comes to including products. But that being said, and then there's also a quality area as well in regards to like if there's CGMP and all that kind of stuff. But that being said, if these are brands you're not familiar with, or you have brands that you prefer, you can change those templates and they become, they populate in your My Template or My Dispensary section, and you can use them with the brands that you're comfortable with. But that's how we end up selecting those particular products to match the ingredients.
Perfect. The next question is, how do you address discrepancies between hormone levels indicated by Oova and patient-reported symptoms during treatment planning?
I guess I don't understand the question. So, and you broke up a little bit. So can you say it again?
Yeah, of course. How do you address discrepancies between hormone levels that are indicated by Oova and patient-reported symptoms during treatment planning?
I guess it's like if the Oova is saying one thing, but then the patient, like for example, if there's like low progesterone and maybe they're not experiencing any low progesterone symptoms.
Right.
Yeah. That's what they're.
Yeah. I would, at this point, that would be where I would really do the intervention. And that's a clinical call, right? Because I would probably go by more symptom-based at that point. I know I have this weird thing that I talk about cervical mucus, where I really think it's a North Star for people. So, which sounds horrible, but just when all else fails, we really kind of try to listen to the patient with as much accuracy as possible and then treat that way. But I think, again, that depends what type of clinician you are, I think.
Yeah, I totally agree.
Yeah.
And like sometimes, it's like you're not necessarily, you're treating a person, not numbers.
Yeah.
Right. So if it's not manifesting, perhaps it's in the earlier stages. And if there's really, for example, no symptoms of progesterone issues. I mean, when it comes to fertility, you want to be careful, because with progesterone deficiency in this example, like the risk of pregnancy loss is really high, right?
Yeah.
Even if they're not necessarily experiencing spotting before their period or anything like that, it might still be a good idea. But yeah, I would, like you said, Dr. Hoen, like it's a clinical call. But for me, I try to treat the patient, especially if there's no symptoms of that particular, manifestation.
Yeah. And it's really rare, like specific demographics too. You want to really look at the luteal phase first, right? Because it is almost like backwards design a little bit, because you need to like really prepare and protect that embryo, which is what progesterone does so lovely in a lovely fashion. But remember, it's estrogen production is ubiquitous in the body, but progesterone is really only at that one time. So just creating that support and that intervention, I think, is really important just to cover your bases.
Yeah. Prevention for sure.
Yeah.
Wonderful. Well, it looks like that is all the questions that we have for today. So I just wanted to thank both of you again for being here and everyone for joining. As a reminder, we will be sharing a recording from today's presentation, so keep an eye on your inbox in the next few days. And thank you again for joining us.